Welcome. This is our Legislative Perspectives on Maternal Health panel, navigating policies for improved outcomes. Mr. Burris and I made the executive direction or decision not to go through 15 minutes of bio. So as he speaks with our esteemed panelists, he'll ask them to provide their name, where they're from, and maybe a quick fact about them, but we thought that'd make the best use of time. So with that, I'm going to pass it to Mr. John Burris.
Thank you. They told me to take this microphone, so thank you all very much. And I'll just serve as the moderator today. And like Ryan said, thought it would be best to get to substance because there's a lot of good, positive substance going on in state government right now, and we want to give our panelists an opportunity to talk about that. They will introduce, if y'all will, a little bit about yourself at your opening comment. Just where you're from, what you do. But otherwise, we'll get straight to substance. I said my father is a Baptist preacher in a small town, and so I've kind of grown up under the model of tell people what you're going to say, tell them, and then tell them what you said kind of approach. So as we were preparing for this, I thought we'd set some anchors for the discussion, but then at the same time, it's very free-flowing between all of you. Chime in, of course, whenever you would like. But I thought for a structure of what to talk about, there's a lot of good things that have happened in the past. So I think we'll start here in a moment with Senator Ervin talking about Our Home and Maternal 360 and some of the programs that are already in place that lay the groundwork for progress. There's also forward-looking. So Representative Johnson, I know you've been participating in a lot of the meetings that started last week, as have all of you, but there's meetings starting last week with stakeholders that are more forward-looking. I think that would be good to talk about. Representative Pilkington, you've been very outspoken on issues of contraception, but also coverage gaps that exist in Medicaid for pregnant mothers and postpartum mothers. I think that would be good to hit on. And then Representative Bentley, you've been, in addition to all these topics, you've been recently very active in expanding programs for midwifery and other programs. So I thought that would be good to hit on too. But again, those are just kind of the core anchors of a discussion, but very free-flowing, and everyone please chime in on anything because you're all engaged on all of these issues. But I think those are the good things to hit on. But with all that said, Senator Ervin, tenure, you've been in the Senate since 2011 and serve as chairman of the Senate Committee on Public Health. If you would introduce yourself a little bit, and as I said, say anything you'd like to say, but if you could focus on Maternal 360 and Our Home and some of those programs that you've helped create and foster, I think that would be a great place to start.
Thank you. Thank you all so much for having us with you today. We're just really grateful to be able to have you listen to us and what we have to say, but understand that this is a dialogue, it's a conversation. All ideas are great ideas. And so we're just really glad that you're here participating in this with us because we can't do this alone. As policymakers in the state of Arkansas, we tend to rely on those people that we serve and our constituents for the legislative solutions and the problems that we're trying to solve. And so for me, my name is Missy Thomas Ervin. I grew up in Little Rock, but moved to Mountain View, Arkansas about 26 years ago with my husband, who's a primary care physician, and started the UAMS AHEC rural residency program there for them in Mountain View. So rural medicine was always a passion of my husband's, and then it became a passion of mine. When you live in an area like I do in the Ozarks, you get a first-hand experience into people's lives who are really the entire spectrum of our population, but particularly those that are extraordinarily poor, but rich in love and rich in family, rich in land, but maybe not economically advantaged at all. And so you have a high population of Medicaid patients, you have a high population of Medicare patients as well. But I think it's just really in working with primarily our Medicaid population and patient base, we really tried to look at what type of healthcare solutions that we need to bring in order to help these folks connect them. And it's really about connecting, to me, it's about connecting to available resources. There are so many resources that we pay for in state government at both the federal level, state level, and sometimes at the local level that just are not coordinated. And there's just so many different avenues, and it's really hard sometimes to navigate. And so the Medicaid expansion program that we put in place 2012, I think. And so that program really morphed, I think, over time. I think for the very beginning part of it, it was known as the private option. It was really the financial aspect and financial structure, but then it morphed into different policy avenues. And the last one that we were able to do, and it was legislation I worked on for a year and a half with the folks at DHS and a whole team of people, was to create Our Home, which stands for Health and Opportunities for Me, because it's about your health, but it's also about the opportunities and connecting to existing resources and organizing the system a little bit for them and saying, hey, this is available for you and this is available for you. And how do we also look at the people that we're serving in this program and make it client-focused and client-centered? So we knew by looking at the data and the claims, we knew that there's a lot of folks in this population that are young women and moms, and maternal health was a focus that we had to really be intentional about. So we created Life 360 homes, and one of them is the Maternal Life 360 home. And it's really about just being intentional in our healthcare policy and utilizing this program as a vehicle to reach those young women who are expecting babies so we can get them more of the services that are available to them, making sure that they're using the program effectively and wisely, that we're not just paying for a premium that's going unused, but that we're actually getting those women into the doctors early, giving them all the different support systems that are already there in their community that they may or may not know about. And so we've, St. Bernard's Hospital in Jonesboro stepped up and I think was one of our first maternal homes. And they have a tremendous support network for expecting mothers. And so we're so excited to see them launch into a Maternal Life 360 home. And then there's another one that's coming on board as well. And so we are looking at how do we strengthen those incentives for hospitals and perhaps opening that up to other levels of providers to participate in the maternal home for these women that we are serving on the Medicaid in that Medicaid program. So I'm excited about it because this program needed the healthcare policy. And we've got to make sure that we're getting people in early so that they have the most successful pregnancy possible. You know, we want them to be a healthy woman because we know if they're a healthy woman, they're going to have a healthy baby. And we all want healthier babies. We were looking at our NICU stays that were being paid for Medicaid, and it was just incredibly expensive. Well, that's an avoidable problem, hopefully. So you have to avoid the baby going and staying in the NICU by starting when the woman is pregnant and making sure she has the strongest, healthiest, most supportive policy in place so she can be the healthiest she can be through that whole 9-month delivery. And I just want to say this too. Who gave you your information when you were pregnant or when you were a young girl? Where did you get your information? Mine was from Mom. My mom. She was my expert. And we, in this crowd, in this room, may have a lot of moms that were fabulous and awesome and told us about our bodies and how they were changing and what to expect and all these different things. Well, there's a lot of young ladies that don't have a mom that's there to be able to help them through that. So it's really important that we rely on our community to support these young women and making sure that they have the best chance of success. And that's just going to be better for our whole entire state, but just most importantly, better for them. So not trying to replace mom, but, I have an elderly mom, and I'm like, hello, I need you to stay here, please, because, menopause is coming and I need to know about this stuff, right? So, but we as women tend to just know about our health through our mothers. But we've got to change that and be more intentional about educating and preparing women to take care of themselves. So I'm going to talk more about that later, but the Maternal Life 360 home is I think it's going to be a great game changer. We're getting started in it. Super, super proud of the people at the folks at DHS that I worked with under Cindy Gillespie, that I'm working with now with Janet Mann and Christy Putnam and the health department, Renee. So that's really exciting, I think, for our state.
It is, and I'll say, and thank you, Our Home, the program that she's referencing, Arkansas was one of the first states, southern states, to expand Medicaid coverage in 2013 for low-income adults, and growing it into Our Home through commercial plans. We're the only one, and so that creates a unique situation as we talk about coverage options for women in that postpartum setting, which is something that Representative Pilkington will likely hit on here in a moment. But it's unique, but it's also an opportunity, and so we'll circle back there. But Chairman Johnson, Representative Johnson out of Sebastian County, and also an emergency room physician. But moving to you, and
if I can't figure out how to turn on my mic, is that a problem?
do what?
I wasn't sure I could figure out how to turn on my mic.
You're a doctor. People let you get away with
The
stuff.
people are not going to
So,
feel safe in the ER if I can't get my mic turned on.
That's
This is
right.
no doubt.
So moving towards the future and,
Yeah.
and some of the working groups and ideas going on. We'll take it away.
Yeah, Chairman Johnson, that's a very official title. So, I look around the room and I see a lot of faces that I know, some that I don't. I think the most encouraging thing for me is that, if you don't know and you can't tell from this interaction, you wouldn't have to be around us long to know that we're all friends. We're all friends with the folks sitting over the table. Representative Pilkington was joking about it, almost like you're sitting in front of the teachers, right? Because all the agency folks are over here. But we all work really well together, and there's a lot of good ideas being generated, right? And this is the room full of people that I'm confident can come up with the right ideas to affect the change we need to move the needle. Now it's about sort of translating all of the, I think we've spent a lot of time talking about what are the problems, right? We know there's problems with workforce. We know there's problems with education. We know there's problems with clinical outcomes, problems with access to care. And now we're in the phase of, transitioning those problems into ideas. What are the good ideas where we can maybe address some of these issues? And then how do you translate those ideas into action? And the good news for us in Arkansas is this is not the first time we've faced some sort of healthcare crisis where we've had to make a difference. I think back to 2009, before we started the trauma system. At that time, there was a high percentage of deaths in Arkansas that were deemed to be preventable traumas. We were one of the last states to initiate a trauma system. If you're not familiar with the trauma system, it's how we coordinate care in Arkansas across the spectrum of trauma that happens, right? It's how we make sure if you have a trauma in the field that you get to the right place, the right time, the first time. And if you get somewhere and need to be transferred, we coordinate that transfer. It's also how we leverage performance through grant money to the hospitals. It's how we leverage outcomes because we tie their grant funding to certain education outcomes, both community education and also education with providers in the facilities. So we started that around 2009, and by 2014, we'd seen a 50% decrease in preventable mortality in trauma, which is a real success story, right? That's something we should pat ourselves on the back for. We proved that we know how to find a problem in the state and reduce it. When you look at what we've done with our stroke program, in 2010, we were at the bottom with stroke mortality. So we were last, we were 50th. About that time is when we started AR Saves, which again, if you're not familiar with AR Saves, this is the statewide system for caring for strokes. This is how we educate our hospitals and our providers about strokes. It's how we educate our community about stroke prevention. It's how we coordinate care. And again, within the start of that till now, we've seen over a 20% reduction in stroke mortality. So we know how to move the needle in these spaces. And now we have the same opportunity to do something like that with maternal health. You know, I'm convinced that one of the things we need to do is to try to organize our delivery hospitals into a system of care the way we have with stroke, the way we have with trauma. I think there's a real opportunity there to maybe make some changes and maybe, you know, provide both support for the rural facilities to offset some of the load for the more urban facilities by making sure not every delivery that needs to be transferred is always going to the highest level of care. Sometimes there are deliveries that can be had in different places, and we just don't have a call center, right, to coordinate that, and that's something we do have with stroke and with trauma. But there's a lot of good ideas out there. You know, this process that we've started that the governor initiated, I thought that was really good. I admit, like, kudos to the organizers, because if you weren't there, some of y'all were there. I mean, I walked in a little skeptical that it was going to be productive. I mean, I'm just being honest, because it's a room about this size with this many people, right? And how do you get this many people to constructively communicate ideas? Well, it turns out there's a way. You divide them up into the corners, and you have little groups. And, you know, we had some great group discussions, and that generated some good ideas as well. And I'm pretty sure that we're going to have follow-up meetings on those committees, and then come back as a group, and again, move from, you know, this idea-generating phase into specific, actionable strategies that we can initiate. And you know, I'm really optimistic that we're going to move in the right direction and see some good changes.
That's good. You know, they joke that a camel is a horse designed by committee, and so I don't think we're going to end up with a camel at the end of this. Not with the right people involved. But you know, I might, Representative Bentley, come to you next. But just in the new idea front, yeah, there's always progress in this world is never fast and it's never final. You know, but you've worked a lot on expansion of access and care opportunities, specifically with the midwifery program. So not so much even on the politics of it all, but just on the why it's important and some of the things that even recently you've accomplished to move that idea forward.
Sure, thanks, John. And you know, as a state legislator, the one thing I love about it is we can look at other states and see what they're doing successful. We don't have to reinvent the wheel, so we can really look and see what other states are doing. And the first thing that we did was a bunch of female legislators in 2019. We passed, Representative Garner was part of it, we passed legislation to start the Mortality Review Committee so we can see why are women dying in Arkansas? What's the cause? What's the cause behind there? Why are children dying? So we have to know why in order to be able to fix it. So that was really the first thing that we did. And I would say that COVID kind of got a little bit in there. We got distracted with COVID, so the results didn't come back. But as we started looking at the reasons why, we can see that hypertension is a problem, diabetes is a problem with that. So one thing I looked at first is thought, well, what are some things that can fix that? So passed legislation in 2022 to allow require our schools to teach why we want to breastfeed. What are the benefits of breastfeeding? Because one of the things we know is that moms can get rid of hypertension, they can get diabetes, and children will be healthy throughout their whole life, not just their infancy, but their whole life. And it's a lot of work. It needs a lot of support. I have two, my daughter and my daughter-in-law just had a baby that's 1.5 years old, and it's a lot of work, and they need a lot of support. So employers need to know why in the world do we need to let that woman go pump, and why is it so much work for the husband? But if we know the long-term benefits for the child and the mother, we can all work together and make that happen. So that's why I passed that legislation, and I'm really excited about that, to see some people in the crowd that are going to make that happen and move forward, because it is, we're all working together. I love Arkansas. We're a small state. We all have great ideas, so everybody's idea is important. So then looking at other states and seeing that they had certified nurse midwives, were really the states that were doing a great job on maternal health, had a lot more deliveries. And we had the lowest number of certified nurse midwives in the state, the least amount of deliveries for midwives in the state. And I was blessed to have a certified nurse midwife with my 2 children. I had a great experience, and I want that option. Not every woman wants it, but let's have that option. We can fill in the gaps for some areas that we have in the state. So the first thing I realized is that Arkansas is the most restrictive state in the nation. We had the most regulations, and we know that regulation just decreases access. We can all look and see that if we can get rid of some unnecessary regulations, we can expand that scope of practice. So the first thing was pass legislation to give them full scope of practice where they can operate on their own, and they can be a team player. No one is on this alone. No one needs to be delivering babies on their own. We need to have a team effort. So the other thing I thought we needed to do was make sure we had certified nurse midwives in Arkansas, because we had no program. So I'm really excited that even in a fiscal session, we passed a good bill to make sure that we're going to start a certified nurse midwife program at UAMS where it needs to start. start, because UAMS is going to be able to get that team approach going, to get everybody working together and put those women where they need to be across the state. So I'm excited about the future. There is no silver bullet. We all know that we can talk all day. There is no silver bullet to fixing that, but it's one thing I think that'll make a good progress down the line. We can all work together. So thank you guys for your time and effort. It's really exciting to be a part.
Thank you. And I left off registered nurse, rural Arkansas.
Yes, I'm sorry, I forgot about that
Yeah.
introduction. So I have a registered nurse working in Perry County, Arkansas. Worked at Children's for a number of years, but in 2000 I took over a family business. I'm a small business owner, so I've been happy to be on public health and labor for the past 10 years on that committee. I love it. It's a great committee, so I've been able to use everything I've ever learned my entire life really on that committee, so I've just loved it. Thanks.
Thank you. Representative Pilkington, kind of coming back. I thought we could do dealer's choice almost. I don't know if you want to talk breast milk bank at UAMS, contraception access, or coverage gaps, or all three. You're the last kind of anchor topic, and then we'll have some free-flowing conversation. But you've been a very vocal voice on these issues for a long time and have passed a lot of legislation. I do think it would be good to hit on the coverage gap and how it relates to our home and how Arkansas is uniquely positioned to address that postpartum coverage, but also any other topic, dealer's choice.
Sure. Yeah, it's great. I think we've made a lot of good progress, especially with this team of legislators. So there's lots to choose from. I mean, with mental health screenings we could talk about, screenings for newborns. That's other legislation. I think me and Senator Irvin worked on that together and got that passed. And so a lot to choose. But real quick, I'm Aaron Pilkington. I'm from Knoxville, Arkansas. You can say Clarksville. It's Johnson County in the River Valley. I'm in my fourth term. I got elected when I was 26 years old, and the speaker at the time, Gillum, sent me to a conference on women and children's health, and I was like, I'm not married and I have no kids, so why am I going? But it was a conference that launched 1,000 ideas out of me, and it's been great. So I've been working on this issue ever since, and I've had a lot of major policy wins. Now I am married and have 2 kids with a third one due June 2nd, so my wife's about to pop, so she wishes it was tomorrow, though. She's at that point of pregnancy where she's like, I'm over it, I'm done, let's get this going. But yeah, the breast milk bank was a great opportunity. I mean, it was something we saw where we were, having to import milk. We had mothers who were producing, who were having to export it, and it made no sense. We were sending state dollars out of state, too. I mean, it's one of those, it just ticked off all the boxes of what's good policy was to create our own. And so I'm really happy about that. Happy we were able to cut the ribbon this fall. And I appreciate Senator Bozeman for all his support as well. He's been a great advocate on this. I really cannot praise him enough. I mean, he has just done such a great job in this space. And he's always been very supportive of, I think, what we're doing in the state legislature. But on the coverage, I think as a lot of you know, I sponsored legislation to do 12-month postpartum coverage. Was not able to successfully get that passed. But what I am excited about is, recently during this fiscal session, we were able to pass some special language that mirrored what the governor said. If you listen to the governor's press conference, he talked about, we already have programs in place, and really, and Senator Irvin kind of mentioned this a little bit, we have underutilized programs as well. And so it's, okay, can we use the programs we currently have and utilize them so that we actually get people on the plans they need to be on so that they're getting their coverage? And so I'm really excited about that. I think it kind of helps get the ball rolling, and we've got a way to measure it and to make sure that we're actually getting women onto the plans they need to be on. And so I'm excited about that special language. I think that was a good policy. And I think ultimately, too, the reality is the match rate's better for the state, which is, as people who are constantly worried about the budget, and we have a balanced budget amendment here in Arkansas, so we can't deficit spend. That's always a consideration. And of course, too, what happens at month 13? I know we always talk about the 12 months, but reality is part about having healthy mothers, healthy families is making sure that they're healthy for the rest of their life, not just that 12 months that we're tracking it and say, hey, job's done, we can pack up and go home. We've got to be there after it. So excited about that, just excited about the more we can do to kind of improve those programs. But and then, of course, on contraceptive, we passed contraceptive to be able to be acquired at the pharmacy with a 30-day supply, worked on that. And then, of course, the LARC legislation that happened this last session also has been a proven model in other states to help reduce unwanted pregnancies in the future. So I think those are all good policies that kind of help us get where we need to go and do the things we need to do. But I'm just excited. There's still a lot more work to do. we've got a great team up here. I think the nice thing is maybe we don't always agree on every policy, but I would say on the majority we do, and we're all trying to go to the same goal. And that's something our governor said too, which was, we want to make sure all women are covered and that they're getting the care they need at the right point. And so I think that's a good goal, and that's a good kind of North Star to point ourselves to. So those are things I'm excited about. And just another thing too is I think as we expand coverage and make sure that people are covered in the right coverage category they need to be in, now it's an issue of making sure that we get them access to what they need. And so by expanding telehealth options, by working with, I think, some private sector, nonprofits, for-profits, whoever, who can help us meet that need, I think that's a really important part. And then so it's how do we go forward and create these partnerships? If now they're covered, now there's payment for treating these women, how do we make sure that then we use the technology gap? Because we did the legislation to allow for telemedicine, and so, but now it is, can we get it to where it's there, accessible, they're used, they're trained, they know how to do it? Because it doesn't make any sense to allow it, to deregulate it so we can use telemedicine, but then they're not using it because they don't know how to do it or they don't have access to the technology. So.
Yeah, that's good. And, to elaborate on the LARC legislation, I see Dr. Manning there. That's a little bit of a technical issue, but the legislation allows state Medicaid to pay for a LARC insertion voluntarily in the immediate postpartum setting. It's better for the patient. It's better for the state because you're not replicating costs from an anesthesia and admitted standpoint, and it allows better spacing for mothers to plan their future and their family. And so that was legislation that was passed. Years blur together. This session, last session, something. This past session. So, but it's another example of an important policy that is incremental progress, but important progress. So,
well, along the LARC conversation, long-acting reversible contraception is what LARC stands for. You all may know that. But we were also able to identify about 3 or 4 million actually from the trauma system or fund that we were able to redirect with our health department to provide free LARC contraception through our local health units, which are all across the state. So Representative Deborah Ferguson and I had teamed up on that several years ago so that we can really concentrate on buying the supply of contraception that we know is more effective and more preferable for women. So that was a huge, huge thing and kind of a policy direction that we need to continue to move on as it relates to contraception.
Yeah, and I don't know about y'all, but I think sometimes that piece of this conversation is easy to get left behind, right? I mean, we still, I think, lead the nation in unplanned pregnancies. I'm looking out there getting a few nods. If we're not leading the nation, we're close, right? And part of this maternal health issue is about having a planned pregnancy, right? And and knowing, going into this with an idea of what you want to do, and part of the problem with that is access to birth control pills and making sure people understand that we can provide that in a way that is not just accessible but effective, and certainly LARCs are in that category.
Can I also just brag? I love that we have dads up here. It's so important, and I've seen Aaron Pilkington grow up right before my eyes because when he was first elected, he was single and then he got married. Now he's got 2 kids and a third on the way. And so it's just really fun to see your colleagues, grow up in front of your eyes kind of. But just to have that kind of passion and just like empathy for your wife, and I just have to brag on him because we need more dads in this space. We need more men and their voices to step up and say, hey, this is really important. And so I want to brag about that because I think you were also the one that put in the lactation room at the Capitol. And so, and to follow up on the providing lactation spaces and lactation rooms, we have one now at the state capitol thanks to him, and I think Breanne Davis helped lead that in the Senate. But this past fiscal session, you may have missed, but on Tuesday, we passed an appropriation bill, which there's no money yet for it, so we're looking for money if you're with a foundation out there. But I teamed up with Supreme Court Justice Rhonda Wood. And she called me and she said, hey, did you know that, we need lactation rooms in our courthouses? So let me just read the statistics to you. Just in 2023, we had almost 32,000 domestic relation cases in Arkansas, over 10,000 child welfare and juvenile delinquency cases. And this does not include all the women that pass in and out of the courthouses in civil court, criminal court, probate cases, are parties, witnesses, and potential jurors. And so we pass an appropriation bill to provide a line item for our court system through the administrative offices of the courts to build and provide a lactation room for nursing mothers. Back to what Representative Bentley just talked about and making sure that it's a culture thing. And it's about saying, hey, nobody wants to breastfeed their baby sitting on a toilet in a stall of a public bathroom. You want a comfortable chair to sit in. You want to be able to hold your baby. You want it to be nice and quiet and peaceful, and because that sometimes isn't easy for some women. So it's really also about just making sure that we change the way we're talking, but also acting on that and changing a little bit of our culture to recognize the importance of these types of things. We all know the importance of breastfeeding, as Representative Bentley talked about. We've acted on that at the Capitol, and so now it's just great to see Justice Wood and Justice Cody Highland, support that. Justice John Dan Kemp, he was so excited about this. He's from my town in Mountain View, and we were at the Folk Festival Parade, and he was like, I love this. Thank you so much. And I'm like, that's great. It's just great to see our judicial system also kind of, follow the lead. So I think it's just important as we continue to change our mindset around the culture of we as women and what we deal with.
No, those are great points. I didn't even know that about the court system, and so that is a great point, and they do deserve a lot of credit. I would say I was going to address it. There's a little bit of tension between Representative Pilkington and I. My newborn is a little bit cuter than his newborn, and so it's created a little bit of tension. But I think
I've seen you grow up in front of my eyes too.
I think
my grandchildren being all yours.
I forgot about that.
But no, those are great points, and I didn't even realize that. So it's good to know. So we've got 10 minutes left, and I think all of these are really important. And I mean that. I think there are a lot of things happening publicly, but also a little bit less publicly that are positive. But I think it's important to say I don't think anybody on the stage has rose-colored glasses about where we are. Like, we know that we're still low-ranking. We know that there's lots of room for progress. I'll editorialize, but say none of these things change quickly, and I think that's what's frustrating at times. You can pass a bill, and it's a year before rules get made, and then incredibly downstream before you actually see an effect culturally in society and in mainstream. So, all that said, I think hopefully it's been informative and helpful to hear some of the positive things and the focus that's going on both executive and legislatively. But in our closing minutes here, I think it'd be helpful for each of you to just talk about what you want to see in the next year, definable, indefinable, and how you're going to define success, and just overall where you hope to see our state get and improve with all of this focus over the past year, to the credit of yourselves, the executive, DHS, lots of focus, but where are we trying to get, and what's your very tangible hope for outcomes? Whoever wants to go first, feel free.
I think what we have going now, we'll be able to isolate what we need to do for each area, because we know Arkansas is very different, right? Very different in Yell County or Perry County versus urban areas. So I think what we've got going now with the governor's task force and things that we're doing, we can isolate those areas and what do each area need. So I think we are laser focused, and I told myself we're going to be laser focused, but I think the whole state is laser focused, and I know without a doubt we're going to solve this issue, and I think we're going to bypass Mississippi. We're going to be one of the best in the nation. I just see it. I know that we're a small state, but I see great things ahead. And I'll be overly optimistic, but I see that we're focused now. We've got a plan ahead. We're going to be able to get to those smaller areas. And again, like you said, John, it was like this certified nurse midwife program won't start till 26. We won't have any graduates till 2028. So it's not like it's going to be an instant fix, but we are focused on what we need to do. And I think as we continue to see, we're going to continue to get reports from the the Maternal Mortality Review Committee and the Quality Review Committee will continue to see what do we need to do, and we can see specifically what progress we're being made. So I think I'm excited. I'm excited about what the governor's executive orders, and that we are all working together. We've got a great team, and I just can't see us not really fixing this. And I'm going to let Senator Irwin talk about what's beside her before we end about.
You want to
tomorrow.
close with that? Is that okay? Yeah, perfect. And I'd also say, just I'm sorry, but we'll close with this event coming up. But also, I think it's good to tell how can people help. And I know it's something y'all talk about a lot, but weave that into your answer, please.
Sure. Well, I think what I would like to see in the future is, I keep on thinking about this like a rubber meets the road kind of situation. You're a woman, you wake up in the morning, and you say, something feels different, you take a pregnancy test, and you're pregnant. That should start a clock, and that starts a process where, you can go and there's a clearinghouse and there's a direction of how you're going to get access, and you need to go here, 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 depending on your situation. I mean, there's all these different funnels you need to go through depending on who you are. And I would hope that in the future we have, whether it be a clearinghouse or some sort of process in which we're able to basically hold the hand of the woman while she goes through this, to make sure that she's getting to the resources she needs, she's seeing the provider she needs to see, and so from there to 12 months postpartum, everything's taken care of. And then that if there are breakdowns, we know where it was and to fix that issue. So that's what I'd like to see in the future, a really clear path, because ultimately it's about the patient. And so I want to make sure that the patient, it's easy and accessible, but as the same way too, they are being guided almost. It's like, I kind of joke like, like TurboTax, like they've made it almost idiot proof. Like you answer a question and it takes you to the next question. There's only 3 choices. You're going to fall in one of these categories. And then, it's almost like that, but the idea is like, it just kind of helps you move through the process because these are very complex things. I work in healthcare, and it's very hard sometimes. I mean, I literally have looked through some of these documents that we ask people to go through, and I get confused and the eyes glaze over, and so I think we just lose people that way. So my hope is that we essentially make the process easier. And then what I would ask for y'all to do is just think about, in that process, where do you fit in? How can you improve the handoff from the primary care provider to the OBGYN, to the the OB, to then the primary care provider afterwards, to the pediatrician who's taking care of the baby. Like one of the things I like about the mental health screenings is we allow pediatricians to bill for that as well. And so the idea of that, they're seeing mom there, and maybe she's only got one time this whole week that she can take off work. She's got her kids with her, so she's choosing her kid's pediatrician's appointment over her own appointment. So do we meet her there in that clinic? And then, of course, too, how do we utilize the brick and mortar that already exists all over the state through partnerships, especially like UAMS, to where that they're saying, okay, we've already got a clinic, Community Northwest in this town. How can UAMS leverage their resources to operate out of there so that resources can be brought to the patient, as opposed to hoping that they're going to come to a campus here or all the way down in Little Rock? So I just think the way you can help us get to the point where it almost seems, seems very easy for the patient to get through the system is, where are the hurdles that you feel, and then how can you fix them? Because oftentimes I think we're very say, well, if UMS would do this, my clinic can make this work easier. And it's like, well, but what can you do to make the job easier for UMS? Because no one's in this field because they want to not treat people. We're in here because we want to treat people. But oftentimes the reason why people fall through the cracks is because we made processes too hard and too cumbersome to make it to where they actually work. And so I just think, if you can think about how do we improve the handoffs, and then, like I said, in the future, I'd like to see a path that basically makes it so simple as, I wake up in the morning, I'm a woman in this scenario, I take a test and I go, okay, I'm pregnant, what do I do next? And there's a clearinghouse say, we're here to hold your hand, and we're going to get you everything you need through this process. And so that's what I would love to see.
Good, thank you. Representative Johnson?
Yeah, I'll just echo some of that. I mean, I think there's a lot of good resources right now in our state, but trying to have those resources consolidated in one place where patients can easily access those. We've talked before, several of us here, about this idea of having a QR code. There's a program in North Carolina. Mary mentioned you don't have to reinvent the wheel, right? There's a program in North Carolina called I Gave Birth, where they give just a simple little rubber bracelet to their patients as they're discharged from the hospital, with a little education pack to remind them that, hey, your body's different. You've had this baby. Wear this bracelet for the next 6 months, 12 months, so that if you have an encounter with a physician or a provider, it reminds them that their bodies are different, right? And we've talked about the idea of maybe putting that QR code on a bracelet. How great would that be, where you could just scan that and then it takes you to a page where all of the resources are there in a concise way where we could all see those and organize them. I would love to see us have an organized resource page for our mothers to look to and to find all that information in a consolidated way. And as far as like what we need from y'all, I think it's what we always need from the people around us, which is we need good ideas, right? We only know the ideas that we know and the ideas that people tell us. And we're all very accessible. Dr. Campbell mentioned that this is, there's no 7 degrees of Kevin Bacon in Arkansas. There's only about 3. So if you don't know our numbers, you're going to know somebody that knows our cell phone number. I'm confident. Reach out to us if you have thoughts and ideas. We need, everyone's input to try to make this better. And again, there are so many, really smart, qualified people in this room. So don't be afraid to reach out to us with ideas that you have.
Okay, so some of the best ideas that come from us ladies are around lunch. So Mary and I went to lunch with Christy and Janet and Renee and Kay Chandler, our Surgeon General, who's an OB-GYN, and Casey was there with us, I think. Anyway, there you are. And so we had a great time around lunch one day, and we dreamed, we're like, policy is one thing, and that's what our job is at the legislature, but the harder thing to do is education. And it really is, it's intensive, it's hard work, you have to be very grassroots, you gotta just be in the community. So we came up with the idea, today is May, and today starts the National Women's Health Month. So the month of May stands for MOM, Mom. And so the month of May launches today, and it's really about, so we've created this cute little t-shirt, but the whole month of May is about celebrating women's health. And tomorrow at the state capitol, we're having a huge health fair out in front of the state capitol with food trucks, and I think we have over 30 vendors signed up to come. We have mobile health units coming. We have all kinds of programming happening, yoga instruction. I put a bug in somebody's ear to provide a bunch of flowers so women can make their own bouquets of flowers, because it's really about every part of our health is important. And so we have flyers here for it, but it's tomorrow, May 2nd, from 4 to 7 in front of the state capitol, inside the rotunda if it rains. But to carry on your idea, we created a health journal. So these are going to be available at every health unit in the state. Every county has a health unit, an existing resource that we need to connect women with. That's your job. Everyone in this room, that's your job for the month of May. You need to get into your community. You need to put it on social media. You need to encourage all the women that you know, no matter whether they're Medicaid or private insurance, self-insured, whatever. Utilize your local health unit as your resource as a woman about your health. And when you go there, you'll get this health journal, which is really fun and cute. And there are QR codes in the health journal. It's not a bracelet, but I think that's a great idea, and we'll continue this. But there are QR codes that lead you to a page. Department of Health has created this, and with DHS, we've all worked on this together. There's going to be, where the round spaces are stickers that you're going to get that are really beautiful that they created. And then in this also has like checklists about your blood pressure, your BMI, your cholesterol, your A1C levels, things like that that are really important to us as women, to track and to take care of yourself with. So this is a tool that we're using. And then also, you can team up with any shop or business to promote this. We want all of our businesses to promote National Women's Health Month, the month of May. as Celebrating Women's Health. Any business can do this. They can print these for themselves if they want with our QR codes. It's about getting the information out there. And so we encourage you to look on the Department of Health website. We will send you the electronic version of this health journal if you want to print it and put your logo on it. That'd be great. But find out a way you can promote month of May for any women that you know in your organization, business, or in your community, and take advantage of that. And then I will also say my niece, Kendall, she owns Fringe Boutique and Chenal Promenade in Little Rock. She's teaming up with us and other women, View Life in Mountain View, Arkansas. They're promoting it all month of May. And so if you bring your journal in, you're getting a 20% discount at her store. That's how we do this, right? And so, go to places and get them to help us, especially if they're women-owned businesses that are interested in helping other women get healthier. So I'm excited about this. It was a great team effort. So you can celebrate that with us. And that's your homework. Everybody in here, you have homework. So we have flyers, and we can send this out electronically. And we'll ask everybody to make sure that you all get this information electronically as well.
Thank you all very much. Thanks, Ryan.
So we're over time, but was there one question, anyone?
I'm Bella Lawrence. I'm Marshallese, and I have a burning question since the beginning of this session. I'm also a nurse. I'm a PhD candidate, and I just recently migrated here from Hawaii, but before that, I was in Illinois. I have to say that the care that my people, the COFA people, Compact of Free Association, aka the Marshallese people, are getting here is tremendous, and thank you so much for what you guys do for us. I focus a lot with maternal and child health, and there are still a lot of pregnant mamas, Marshallese moms, who fear to go see prenatal doctors. And the reason is because of their fear for Medicaid and the insurance and the costs. As you know, in March of this year, President Biden passed the Compact Impact Fairness Act. And right now, we don't know what's happening with state to implement that. I'm taking this very personally because our people in your state who contributes to the economy are suffering. I'm a great contributor to your economy as a nurse. Also, the fact that it was mentioned earlier, because there's a lot of recurrence hospitalization among our people, we can be a part of that impact with your economy when these services are immediately activated, as we need to get those federal benefits back for our people immediately. Is there a way that, I know we're talking about maternal health, but I'm talking about the holistic of this population. Is there a way that the state can help our Marshallese citizen implement that quickly? Thank you.
I'm not trying to answer, but I truly am over time now, and so are you okay if I take this offline, and then we can dedicate time versus trying to hustle through an answer? Is that okay with you?
Yeah.
Okay.
Yeah, that's good. Thank you. Hey, no, thank you. And let's visit, because I know that the state legislature in recent years has made a lot of improvements on the access for the Marshallese population on Medicaid, because it is a niche issue, given the relocation of how it happened and the history of it all. And so it is a very important point.
I think lots of us would like to hear the answer and would be willing to sit here.
Well, no, I'll just say, no, I appreciate it. I think it is a very big and general question in a way. I know that there was very specific policy improvements on Medicaid access from the Marshallese population in recent years.
I would want to have a discussion and understand the question better before I gave what I thought was a real answer that I could stand behind. The hard thing about doing these panels, we all, like none of us, I never got any training on interviews, right? I mean, I can take care of an emergency. I'm halfway decent at writing policy now, but being in a room and taking a question spontaneously, there's a tendency for us to want to immediately open our mouths and start talking, right? Because we want to give you an answer. But the truth is many times the best answer is one we have time to think about and have time to have more of a discussion around. And that feels like, for me, this particular issue is one where I would want to find out a little more information. And again, I'm happy to visit. I'm sure we all are.
Well, and I just want to say there are constant issues between the state government and the federal government and CMS. That is a very complicated circle, okay? And so there's a lot of policy changes that happen at the federal level that, or that happen at the state level. And at one point, I think we actually acted against the federal administration's policies and CMS in order to open up Medicaid coverage for the Marshallese population because it was not constructed correctly, and so we had to apply for that CMS approval. So that is the tricky part about Medicaid policy. We can do a lot at the state level, but it's got to run through CMS and the federal government. And there's some complications that occur with just our process, the federal process, and the legislation that is affecting our abilities at the state level that they may or may not know about at the federal level to be able to address and fix. And I think that's the situation that we ran into with the Marshallese population, because we were kind of a unique state, right? Because we have a great population of your community here, which we're blessed with and happy about. But there was a lot of things that we didn't know until it was brought to the attention of us, and then we were able to try to really address it to make sure that you had that coverage in place. Because I will tell you, I want my husband to be able to get paid to treat people, right? But we all want everybody to get paid to be able to treat people too. I mean, we want to make sure people are taken care of and it's done correctly, and that you're not utilizing the emergency rooms as, primary care options. That's not a good idea. So there's just a lot of challenges with that whole process.
I think too, Janet Mann at DHS can answer this question better than us, because it is a snap change, and we just weren't prepared to answer that question. So Janet texted me and said I can answer it, so I'm going to let her answer, because I didn't know you do want to answer the question. We're not trying to not give you we just want to tell you what we know and what's factual and give you a real answer. So.
So, hello. I think the question is specifically about the change that happened with the SNAP benefits, correct? Okay. So the SNAP benefit is a partnership through DHS and the federal government with FNS. Mary Franklin, who is the Director of County Operations, has been working diligently with FNS to get the guidance to get the benefits out. I know it's not a great answer, but I would like to connect with you afterwards so that we can keep you up to date on what is happening. You're welcome.
Thanks, Janet.
Thank you all.